Compassion consists of three facets: noticing, feeling, and responding. You notice somebody with some condition, you feel that suffering, and then you respond. So the compassion has got all these three components: noticing, feeling, and responding. Empathy. What's empathy? It's the feeling as another. What somebody's feeling, if you feel that, this is called empathy. Then we are hearing the word sympathy. Sympathy means feeling towards another and response to suffering of others with sorrow and concern. So in empathy, you just feel as another, while in sympathy, you feel towards another and you respond to suffering of those with sorrow and concern. But as compared to these two, the compassion, it's feeling for another and responds to suffering of others with warmth and care. This is the difference between these three: empathy, feeling as another; sympathy, feeling towards another; and compassion, feeling for another. There is no response in empathy. There is a response in sympathy and compassion. In sympathy, the response is with sorrow and concern, while with compassion, the response is with warmth and care. So we should be clear about these feelings. Compassion care is a holistic approach to healthcare that combines emotional support with medical treatment. So it's a medical treatment as well as emotional support. It focuses on addressing the person as a whole and considers their physical, emotional, social, and mental well-being. Compassion care has 5 elements, and these are empathy, respect, communication, sensitivity, and support. If any one element is missing, it's not compassionate care. If you want to extend compassionate care towards your patient, you should show empathy, respect, communication, sensitivity, and support. The empathy involves understanding a person's experience from their perspectives. You must actively listen to patients' concerns without judgment. Just keep on listening. Make no opinion. This helps create a space where patients feel comfortable expressing their fears and emotions. For instance, a person with chronic health condition may feel anxious about his treatment. You must listen to him attentively, acknowledge his feelings, and offer reassurance. This will help him heard and understood. The second component is that of respect. It means treating every person with dignity and honoring their values and preferences. This may include using their preferred pronouns, ensuring their privacy, and involving them in decisions regarding their care. When discussing treatment options, you must respect a person's decision-making process. and ensure that their cultural or religious beliefs are considered before moving ahead with the treatment plan. Then comes the third component, that is communication. Communication is important in building trust between healthcare professionals and people. It involves clearly explaining diagnosis and treatment plans in simple terms, as well as addressing any questions or concerns. When delivering a difficult diagnosis, you must take time to explain the situation in a straightforward way, without lots of technical language. This helps ensure that a person understands all their options and feels empowered to ask questions without feeling rushed. Then the fourth element is that of sensitivity. Sensitivity requires awareness of the cultural, emotional, and psychological factors that may influence a person's healthcare experience. You must personalize care to accommodate these factors. For example, a person from a community with strong cultural beliefs about healthcare may be hesitant about certain treatments. A sensitive healthcare professional takes time to understand these beliefs and adjust their care approach accordingly. This ensures that the person feels respected and supported. Fifth and the last element is that of support. Support involves offering physical, emotional, and informational help throughout a person's healthcare journey. It may include guiding them through challenging treatments, helping them cope with anxiety, or connecting them to additional resources like therapy or support groups. For example, a person undergoing chemotherapy may need both emotional and physical support. A compassionate healthcare professional not only offers reassurance during treatment, but also connects them with support groups for people in similar situations. So, why is compassion important in healthcare? And all these 5 elements. Compassion is important in healthcare because it helps bridge the gap between clinical treatment and human experience. When healthcare professionals treat people with compassion, they acknowledge that people are more than their medical conditions. Compassionate care can help a person feel more comfortable and respected. This, in turn, encourages openness and trust. A compassionate approach also ensures that healthcare professionals understand each person's unique needs and preferences, which can lead to better personalized care plans and improve healthcare outcomes. So the compassionate care and counseling in GI and liver diseases, let's have some examples.